Daisy Cooper.
Thank you, Madam Deputy Speaker. First of all, let me start by putting my thanks on record to the Public Health Minister, the Right Honourable Member for South Northamptonshire, the Chief Medical Officer, Professor Chris Whitty, who spent time sitting with me to answer my questions and questions from some of my colleagues. It was a very collegiate exercise. I'm grateful to her, and it would be good to see more of it. Let me start with vapes. The government proposals on vapes are an absolute no-brainer. The proposals are consistent with Liberal Democrat Party policy adopted at our conference last year, including the ban on single-use vapes on environmental grounds. Parents and teachers in St Albans are particularly concerned about the insidious marketing of vapes to young people. The particular colours, the flavours, the packaging are deliberately designed to tackle children. Earlier in the debate, the Honourable Member for Ilford North, the Shadow Secretary of State, talked about children gathering in toilets desperate to use their vapes. Well, I'm aware, unfortunately, in my constituency of one example where children have gathered in toilets not just to use the vapes, but the vapes have been taken apart to be used as a container to smuggle in more dangerous substances, thereby using the vapes as a new gateway drug. So I entirely support the government's proposals on regulation of vapes. The question of the so-called smoking ban on 15-year-olds and younger being sold cigarettes is not so straightforward. Now, for Liberal Democrats, it will be a free vote. And I do think that there are some good Liberal arguments to be made both for and against the proposal. I myself will be supporting the measures in the bill, but some of my colleagues do have remaining liberal and practical concerns, like, for example, in 30 years, how does somebody prove that they're 46, not 45, without a driver's licence or a passport? How can we prevent abuse at retailers? I hope that the government will be providing more reassurances to colleagues on these issues.
Would you give way on that point?
I will on that point.
Would you accept that, in actual fact, that difficulty which he has raised will put the onus on a retailer who is then meant to distinguish between a 45-year-old and a 46-year-old, and if does not do that correctly, could find themselves faced with a fine? Is that fair?
I thank the honourable gentleman for his intervention. I think that colleagues across the House have genuine concerns about this particular point. I know from my engagement in my own constituency that there are a number of people who already suffer these attacks when they challenge people on their age for other products, and so I do hope that the government comes forward with reassurances about what they intend to do to tackle this particular issue. Now, as I indicated, I myself will be supporting the measures in this bill, but it was a bit of a journey for me. My first reaction to hearing of this bill before it's published was one of indignation, because actually the measures in this bill are really a drop in the ocean in terms of what is needed to tackle cancer. 1 in 2 of us will get cancer at some point in our lifetime. The government has missed its targets to provide fast cancer treatment every year since 2015. The government has dropped its 10-year cancer plan. What we need to see is research in rare cancers. We need to see outdated cancer scanners updated. We need to see cancer nurses. We need to see efforts to tackle waiting times. I think at best this clause could have perhaps been used, this bill could have been a single clause in a much broader bill. And to be honest, I am frustrated that so much energy is going into this particular bill, which could be described as low-hanging fruit, rather than a much more ambitious plan to tackle cancer more broadly. And I do think we need to see more ambition in this area. My second reaction was my Liberal hackles being raised. Now, Liberals are not libertarians. We do not object to all bans. Liberals support bans as a last resort, but not as a first lever. And it is frustrating to see the government trying to use this when the government felt a little bit rich to see the government bringing this bill forward, when they had simultaneously been slashing public health budgets, including smoking cessation programmes since 2015. Even with the new money the government has put into smoking cessation programmes, the funds still fall far short of 2015 levels. We also know that smoking rates amongst young people have dropped very quickly, now down to 1%, and continue to drop. But Liberals do sometimes back bans when a particular product or practice provides excessive harm. And this is why I have decided to back the ban. Fundamentally, I ask myself a simple question. Is this going to help reduce the overwhelming harm caused by the significantly dangerous and addictive practice of smoking? And the answer is yes, it is. We know that smoking is dangerous and highly addictive. We know that smoking is the UK's biggest preventable killer, causing around 1 in 4 cancer deaths and 64,000 in England alone. We know that 75,000 GP appointments each month are taken up by smoking-related illness. We know that smoking costs the economy £17 billion a year through smoking-related lost earnings, unemployment and early deaths. We know that it comes at enormous costs to our NHS. And we know that smoking rates in pregnancy vary hugely, with as many as 20% of pregnant women smoking in some parts of the country, increasing the chance of stillbirth by almost 50%. This, Madam Deputy Speaker, is an incredibly stark health inequality. Now, some people have suggested it could be contradictory for a Liberal to both support a ban on tobacco for 15-year-olds and younger whilst wanting to legalise cannabis. But let me say to them that they are wrong. It is entirely consistent for a Liberal to want to to make harmful products illegal, harmful products like nicotine in cigarettes, skunk, and products that have high THC levels that can cause psychosis, while simultaneously wanting to have a legal regulated market for less harmful products like vapes for nicotine and like cannabis products with low and regulated THC levels. So, Madam Deputy Speaker, in conclusion, do I think that this measure is the first or the best thing that the government should be doing to tackle cancer? No. Do I think that this measure is particularly ambitious? No. But do I think that it is a useful step that will help us to tackle the dangerous health impacts of smoking addiction, improve population health and take pressure off the NHS? Personally, I do. Thank you, Madam Deputy Speaker.